Hello, I'm Dr. Rajkumar, consultant pulmonologist. Today we will be discussing about the topic how often we tend to self-medicate for regular symptoms like cold and cough. Self-medication is medications which bought from the pharmacy without any advice and without proper diagnosis of your condition. Most commonly if you see body pains, fever, and then comes cold and cough. So what are the medications which we usually get on counter from the pharmacy without any doctor prescription? For example, for the fever and body pains, we usually tend to take paracetamol, other pain medications which include tramadol, diclofenac, without knowing the consequences and the side effects of those on-counter medications. Then when it comes to the cold and cough, if as we are aware of the previous pandemic effect from the last 3 years, everybody has developed a tendency to take on-counter medication even for the general cold and cough, starting from the azithromycin, going up to the antihistaminic such as montelukast, without properly diagnosing their condition. Self-medications usually are provided by the pharmacist without proper understanding of the symptoms. For example, anybody can have cough. Is cough always danger? No. Cough is a protective reflex. Any cough beyond 2 weeks, there is no particular disease that we can point to the cough like this is because of only pneumonia. There are so many conditions where we have to thoroughly evaluate and diagnose what is the condition causing. Until unless treating the cause, if you just symptomatically suppress the cough, it is going to aggravate the underlying disease. As we have come across so many news, recent incidents found that young pediatric age group children have been suffered serious adverse effect by using on-counter cough syrups and nasal decongestants. Is self-medicating for the pediatric age group only danger? No, it is as dangerous as for the pediatric and the adult population as well. So self-medication in any age group is not advisable. So any cold and cough which is not relieving on home remedies and then it is worsening as such, cough associated with yellow color sputum production, high grade fever, chills, that will be the time for you not to go for on-counter medications or self-medication and to consult a doctor to diagnose your condition. So as we all know, most commonly used on-counter medication or self-medication is for the cough and for the fever. For the fever, everybody knows what to take, that is paracetamol, and for the cough, everybody knows to take cough syrup. So as we know, cough, few people will have only dry cough, which is irritant cough, few other people will have cough with the production. So what will happen if you take on-counter cough syrup? So as the person who is giving you is not aware what type of cough you are having, though if he is aware of what type of cough you are having, we are not very sure that medication which is available in the cough syrup is going to help you in other ways. For example, anybody is having a cough. So what we can think of cough is like a respiratory tract infection, but it need not to be always a respiratory tract infection. As I have told before, cough is the most common presentation for the people with the allergic rhinitis, bronchial asthma. Those are the patients come with the chronic dry irritable cough. So if you want to give those patients a cough syrup that has an expectorant, that cough is going to be aggravated. Second scenario, most commonly in people who are smokers, the condition is COPD. Those who have difficulty in expectoration, if they are giving a cough suppressant, what will happen? All the expectoration, all the secretions will be lodged in the lung, which will be prone to develop pneumonia in later stage. There are multiple reasons for a pediatric population to have a cough. For instance, if anybody is having cough, we tend to give cough syrup. So it is not advisable to give cough syrup. Usually on-counter cough syrups will contain two chemicals which are antihistaminic and which are sedative. So to sedate a pediatric age group children, maybe 1 year, 2 years or 3 years, when they have a cough, which is a protective mechanism. They are trying to bring out all the secretions and prevent the microorganism to enter into the deeper airways. Using on-counter cough suppressants, we are trying to suppress the cough, which is in a way protective, trying to protect our respiratory system by preventing entry of other substances like microbes and microaspirations as well. And overdoses. So as we tend to, as a parent instinct, we will give 1 ml, like whatever the doctor has advised to give cough syrup. We'll watch for 30 minutes till the child is coughing. Then we tend to give one more 10 ml of the syrup, then we will watch. So we are not usually, parent instinct not tend to follow the doctor advice. There is a particular dose limit for every age group, for every body weight. So we tend to overdose the children. What it will lead to, as I told, majority of the on-counter cough syrups contain antihistaminic and sedatives. So kids tend to be drowsy, oversleeping, and then will develop aspiration pneumonias. So I think now we are all aware why we are not supposed to self-medicate, and it is always advisable to consult your doctor on right time. Thank you.